One thing is abundantly clear, ladies and gentlemen, people around the world are getting older. But unfortunately, as we age, it also means we are getting sicker. Something needs to be done to handle the ever-increasing burden on the healthcare organization. Is remote monitoring the answer then? No, it's not. When you think about it, remote monitoring is more or less just a very long cable from the sensor in the patient's home to the healthcare provider who has to monitor the data and then act on it. It clearly does not solve the entire resource problem. So what can be done then? Well, remote monitoring adds value, is necessary, and it's a path we're going to have to go down to, and we do it too, but we can't stop there. We have to go beyond remote monitoring and into remote care. The patients themselves, in fact, constitute our largest underutilized healthcare resource. And we, with our invention, Optilog, can tap into that resource. Optilog is a home-based tool designed specifically for, and in close collaboration with, the senior citizens, the multi-sick and elderly, the people with no experience with smart devices or IT solutions. We provide a full-service solution that closes the loop in the patient's home, turning the patient into an active component of the healthcare system. And Optilog does so without adding any administrative or monitoring burden to the healthcare organization. Optilog has been proven in 3 randomized controlled clinical trials published in peer-reviewed journals to reduce in-hospital care by a staggering 38%. This translates into roughly 2,000 euros per patient in net savings each year, or on a European level, 30 billion euros annually. Optilog is currently the market leader in Sweden and the only one of its kind. It's clinically proven to reduce costs, proven to have the highest system compliance for this very difficult patient population, and the only system that fully incorporates remote care without adding burden to the healthcare organization. Thank you for your attention.
At Brain Plus, we're helping people with disorders of the brain diseases, or brain injuries, recover their cognitive functions and their full ability to live their lives. We do so by creating what is so-called digital therapeutics in the form of cognitive training, behavioral therapies, and other types of treatment methodologies. All of this is presented to the patient or the person with a brain disorder on mobile devices, so they can do these types of therapeutics in their home or at the clinic directly on a smartphone or a tablet. For a clinician, there is a web dashboard where they can track the developments of their patients, they can track the compliance with the treatment, they can track the improvements of the areas that are being worked on. One of our main areas of focus is the dementia field. We're working both with methods of early detection of dementia, with prevention of dementia, and with treatment of dementia. We develop all our solutions in collaboration with key opinion leader scientists and clinicians in big open innovation projects. For example, we are working with the University of Oxford, Nottingham, and Aarhus on dementia treatment and prevention. We've worked with the University of Copenhagen and the Danish National Center for Brain Injury and the Danish National Center for Neuropsychiatric Depression Research on brain injury treatment and depression treatment. And we have other big projects in dementia treatment that we are working with the Research Institutes of Sweden on, and the likes of Alzheimer Europe, the large patient organization in Europe. So we're very patient focused, and we try to get the whole ecosystem to help us develop our solutions. Thank you very much.
Greetings, my name is Normans. I'm representing the Finnish-based company Cardiolize. So we're focusing on the cardiology. The heart health is our niche. And Cardiolize provides the cloud-based heart health data analytics platform for remote monitoring of heart failure as well as post-myocardial infarction patients. So we enable real-time vital sign monitoring as well as analytics. So we look here at ECG, heart rate, temperature, respiration rate, and we do the risk stratification. So this is really useful for insurance and big pharma companies who try to address specific patient groups, as well as for telemedicine platforms who could embed such an analytical layer in their existing environment. So the solution includes our medical grade analytics, CE marked, as well as patented universal ECG scoring system that we have developed. And we do use the machine learning algorithms to calculate the personal baseline of each individual patient. So that means that the data is much more accurate. And we can detect and predict most popular arrhythmias, heart health conditions, as well as see the trends of stress, emotions, and fatigue. So thank you. Let's make the healthcare better together.
Hi, I'm Anita from Research on the Go. And as a medical device company, I know you are dedicated to making the best possible product to improve the lives of patients and care providers. And the best way to do that is often to listen to what your users have to say. But getting that data isn't always easy. There are challenges reaching customers through distributors. There are many data safety and privacy issues to take care of. And customers are often motivated to contact you as soon as something goes wrong, but you often never hear about the positive feedback. But what if getting customer feedback and user data were as easy as adding a QR code to your existing product? That's what Research on the Go can do for you. Go beyond web surveys and allow your customer to get in touch directly through their smartphones. Customize messages and notification timings to maximize the number of reports that you get. Get data directly from patients and care providers, and channel the data to the right people within your organization. We here at Research on the Go are looking forward to helping your company design and implement a complete data collection strategy and jump ahead on your journey towards data-driven innovation. To find out more and to contact us, visit our website, researchonthego.eu, or visit us here at the exhibit hall. We're looking forward to learning more about your data collection challenges. Thank you.
Luana is an artificial intelligence system that can empower and transform your clinic. By utilizing remote sensing modalities, Luana looks into your patients in depth, and one by one, to collect data and provide you with a complete vision into your patient's population, lifestyle, and individual risk factors. Luana automatically creates a personalized healing program utilizing an integrative approach to wellness, optimizing the combination of rehabilitation exercise with activities, nutrition, supplements, and mind. We emphasize on patient education and elevating patient awareness about their health. Luana is continuously present for the patients with instantaneous answers and support, so you can save your precious time and focus on the important work. At all times, you have the power to join the conversation and modify the treatment plan. Your patient's progress will be tracked, and they will stay motivated with high compliance rates.
Hello, my name is Hanne Paulson, and this is my product Vevios, the future of safety alarms. Elderly and chronically ill pays an unreasonable high price for safety in their everyday life. Their safety alarm should guarantee them a lifeline and a direct communication with home care in a case of emergency, but more time than once, their safety alarm has stopped working. Their safety alarm is a false security, and it even had fatal outcomes. And I know this because I worked within the elderly care during my studies as an industrial designer. And in this trying and crisis time, it's even more obvious about the lack of communication and the big feeling of uncertainty that our elderly face in the society today. I came to the conclusion there are three major deficiencies with the safety alarm we have today. C, E, and D. C, communication technique. We're still relying on a 40-year-old communication system which binds the user to the home. E, ergonomics. Bad ergonomics leads to enormous amount of false alarms. D, design. Bad design make people do not want to wear their safety alarm. My product Vevios is a new innovative and mobile cell phone bracelet that operates to work everywhere. Vevios is a cell phone in a bracelet. It's a one unit that can position and communicate with the user everywhere. Vevios is using the latest LTE cellular technology, which provides a battery life up to 2 weeks. E. Ergonomics. Vevios has a new patented panic grip which prevents false alarms. D. Vevios is simple and clean in its aesthetic, and thanks to this we can also reach out to new vulnerable user groups in need of safety and security. The market for Vevios is big. Sweden, 20% of our population is above 65 years old, and within 15 years our elderly population will increase by 50%. We took in the first pre-seed investment round in 2018, and right now we're developing our final batch of prototypes which will be tested on alarm centers and elderly users in this spring. And this will get us an EMC marking and will make us able to reach the market in the end of this year. Our go-to-market strategy is to cooperate with big care companies in non-exclusive deals in order to reach as many elderly as possible, as fast as possible. Right now we're looking for an investment of 10 million Swedish crowns, and of this we've already guaranteed 3 million crowns. And this is in order to industrialize and reach the market in this year. If we reach the market within this year, we're able to break even in 2021. We're a strong, experienced team and board of directors. Thank you for listening, and join us and help us on the journey to create a safer and secure everyday life for our elderly through this crisis and after. Thank you.
Welcome to Cuviva's booth at the HealthTech Nordic Pavilion at HIMSS 220. Cuviva is providing a scalable IoT platform for remote patient monitoring. Our customers, healthcare providers in regions, municipalities and private, are using it for connecting patients, for data and communication at home. The spectrum of patients includes patients with a single location need in primary care who download our app in their smartphone, to digital illiterate multi-mobility patients using our advanced but with easy-to-use interface home solution, a dedicated digital channel for the individual to the healthcare provider if you would like. By this we contribute to increase safety and security for the individual and improve patient outcome and decreased cost of care for the healthcare provider.
Jag vill så mycket, göra så mycket. Bra att ha Monica framför sig. Du vet när det var så varmt, jag hade 28-29 grader här i lägenheten. Så kändes det andnöden ännu värre. Inte varit datakunnig. Så jag blev ju förskräckt och sa, hur ska jag göra nu? När jag nu kan det här så är det ju gjort på 10 minuter. Det är ju en väldig trygghet. Jag ser ju varje dag att jag har alla mina värden är som de ska. Står, säger min dotter, det exploderar inte om du trycker på någon knapp.
See you at the Cuviva booth.
Did you know that smoking and drinking before and after surgery result in a 50% higher risk of complications? My name is Melene Smith and I'm the co-founder. We have developed Miley as a response to an EU-funded call. In the EU, there are 5 million planned operations yearly with lifestyle risk factors. There is no existing solution on the market to solve this problem. To our surprise, just 4 to 6 weeks of pausing smoking or drinking before and after surgery is good enough. Miley is the solution with an app for the patient and a web app for the clinician to follow up and help the patient achieve a successful preparation, surgery, and rehabilitation. We offer both medical and social support based on cognitive behavior therapy. Miley is in a unique position. Our competitors do not have both behavior change and support before and after surgery. We have a software as a service business model. We have a very strong key partners such as Microsoft. The stream of revenue comes from yearly subscription, behavior change programs, and consultancy hours. Already in 2017, we were awarded around 500,000 Swedish crowns from EIT Health and Swedelife for heart rehabilitation. In 2018, the Live Inside project has awarded us almost 5 million crowns. In July 2020, we have applied for EIT Health funding together with partners from Hungary and Sweden to bring MyDay to market. It was a great achievement that we came first among strong competitors such as Johnson & Johnson winning the Live Inside project. We have a successful exit record. In 2002, the inspiration to Miley was sold to Tijuanator in Denmark. We are a fun, diverse and hard-working team for successful surgery.
I'm Timo from Popit. We provide a clinically validated platform that digitizes medication. At the same time, we improve how people take their pills. With Popit, patients miss fewer doses. Also, medication consumption becomes trackable in a scalable way. We're already working with, for example, Pfizer and Novartis. According to the World Health Organization, 50% of patients do not take their medication as prescribed. In addition to the patients not getting the outcomes they should, pharma loses about a third of the potential revenue per medication brand. In other words, a $400 billion problem that's also costing hundreds of thousands of lives. People miss doses due to a variety of reasons, but the majority of missed doses are due to simply forgetting. And it's not the elderly patients. Younger patients are actually worst with adherence. The people who are active in the working life, like you and me. There are apps, of course, but patients quickly develop the habit of routinely swiping away the reminder. Popit detects if you've taken the dose or not with a unique and universal clip-on device. Dose information is sent to the medically certified app and to our cloud. You're getting reminded only if you miss a dose. 80% of the world's solid drugs come in the blister package. Well, not always in North America, but the rest of the world largely relies on blisters. We have a patent to track medication taking from the blister. We already have some of the world's largest pharma companies as customers. Popit makes medication connected on a global scale, and we can also support your key products.
Hi, my name is Stine Sorensen. I'm the COO and co-founder of Radiobotics. At Radiobotics, we're on a visionary path towards creating fully automated machine learning algorithms that can detect diseases in plain 2D X-rays. Today, more than 250 million X-rays of bones and joints are being taken in Europe and the US combined. This number is only growing day by day. However, the number of qualified clinicians is not growing nearly at the same rate. In fact, it takes more than 10 years to become a specialized radiologist. This obviously leads to fatal errors, delays, unnecessary stress for patients, and a higher workload for radiologists when there's simply not enough people around to help with the high amount of images. This cannot be solved by educating more radiologists and clinicians. It will take too long. It's time to introduce new technology that can improve the accuracy and increase the throughput. And this is exactly what we're working on at Radiobotics. Thank you very much.
Hello, my name is Fredrik Ståhl and I'm the CEO and founder of Dianovator. I'm here to tell you about Diact, a personalized decision support system for insulin-free diabetes. As you may know, diabetes is a global epidemic affecting more than 400 million people, and most of these do not reach their treatment goals. To overcome this, we have created Diact, a cross-platform decision support system for both patients and their care providers. By harvesting the patient's device data and uploading that up to our cloud service, our patent-pending and research-based algorithms provide both the clinics as well as the patients with insights in how to optimize the therapy. The business model is simple. Using a software as a service model which scales with a number of enrolled patients, we cater directly to the clinics and incur cost savings to both the payer as well as the clinic. If this sounds interesting, please come to our booth or contact me directly. Thanks for your interest.